The Sisters of Mercy have cared for people in the South for more than 150 years. In 1880, they opened Atlanta's first hospital, later known as St. Joseph's. Mercy Care became a nonprofit in 1985 and in 2001 opened its clinic and headquarters on Decatur Street in downtown Atlanta. Today, Mercy Care is a federally qualified health center, or FQHC, providing compassionate medical and social services across Atlanta, especially for people facing barriers to care. In the early 1960s, the United States was confronted with a harsh reality. Millions of Americans were living in poverty, uninsured, and without access to basic health care. Amid social and economic upheaval, communities across the country faced significant inequities in health and opportunity. In response, a group of pioneering physicians, nurses, community leaders, and volunteers began working toward a new vision for healthcare. A pivotal moment came in 1965 when Dr. H. Jack Geiger and Dr. Count Gibson launched community health centers in Mound Bayou, Mississippi, and the Columbia Point neighborhood of Boston. Their idea was revolutionary: create community-based health centers that would serve everyone, regardless of their ability to pay. This model enabled clinics to serve both uninsured individuals and Medicaid recipients and aligned with the broader national efforts of the War on Poverty, Medicare, and Medicaid. Over the decades, policy changes and economic challenges have contributed to concentrated poverty in many urban communities. Improving health outcomes requires more than treating illness. It requires addressing the conditions that shape people's lives. Public health research estimates that clinical medicine accounts for only about 10 to 20% of overall health outcomes. The remaining 80 to 90% are influenced by the social determinants of health, the conditions in which people are born, grow, live, work, and age. Mercy Care's model of care is grounded in this science and understanding. We know it takes much more than healthcare alone to help people get healthy and stay healthy. But our work is also driven by something equally important: compassion. Every day, Mercy Care team members go beyond the walls of our clinics to meet people where they are. They welcome those who may not realize they need care, listen to their stories, and remind every person they serve that they not only deserve excellent care, they have a right to it. Mercy Care was founded by visionary leaders who believed healthcare is a human right. 40 years later, that same spirit continues to guide our work. Every day, our teams open the doors of our clinics, walk encampments throughout our communities, and provide care for both acute and chronic health needs. Our federally qualified health center continues to make a meaningful impact. Every number on this screen represents a person who found care, connection, and support. These figures reflect the scale of Mercy Care's reach and our commitment to serving people who often have nowhere else to turn. Mercy Care continues to provide exceptional care and stands as a powerful example of how federally qualified health centers transform lives and strengthen communities. Today, more than 32 million people across the country receive care through federally qualified health centers. Community-based health centers like Mercy Care ensure that high-quality, compassionate health care remains accessible to those who need it most.
It's my work here at Mercy Care that has brought me the closest to working and seeing the patients that we serve and exactly the challenges that our patients have and the critical role that a place like Mercy Care plays. And it's healthcare plus. It's plus social care. It's plus housing. It's plus transportation. It's plus so many things. There is no FQHC in the country, and I've lived in several states, that is quite like Mercy Care.